Nurses is going through a crisis right now where they feel like they have been mentally drained. They have not been compensated the way they need to be. Not only that, patients are very disrespectful to them, and then doctors or their up leads or managers rather do not support them whenever they try to escalate problems.
Begging, literally begging. I begged literally all day for help. Nothing. I'm like, dude, this ain't worth my license. If somebody dies, I documented the shit out of every single patient today. Like, I'm not gonna be caught in court for this shit when I'm begging y'all. And then y'all laughing. Ha ha ha. No tech. I'm like, can I get some help? Ha 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 ha. No. That shit ain't funny. We just don't have extra techs laying around.
I hate being a nurse, and that might be a strong statement, and I literally feel like I'm gonna get upset, but I have been a registered nurse for 10 years. I have changed jobs several times because everybody's like, the great thing about being a nurse is if you don't like one area, you can go to another. And I've done ER, I've done NICU, I've done private duty, I've done IV hydration. I've tried all these different things, and I hate it. I hate being a nurse. There are so many nurse content creators on here that love it, and like, I'm so happy that they have found a career that they have loved. But after a decade of being a nurse, I hate it, and I want a new career. So if you love your job and you make a good living, please comment what you do for a living, because I can't be a nurse anymore. I hate it. I am so upset. I just hate being a nurse, and I wish I had never gone into this career because it has broken me down so many times. And like, even when I try to get a low stress nursing job, it's not low stress. I'm still dealing with a lot of the same stuff that I used to have to deal with when I was working in the hospital, and I just can't do it anymore. I cannot do it anymore. And if you're looking to go to nursing school, don't do it. Do not do it. If you want to work in the medical field and you want to help people, go into radiology, become a radiology tech, become a surgical tech. Do not become a nurse. Do not. I 10 out of 10 don't recommend.
Most of them are complaining about their mental health, feeling drained about their jobs, their career in healthcare. You see, back in the days, they were not speaking out. And as well, nurses were booming at the time. The money was good.
When I went to nursing school, I never thought that I would leave the field within like 5 years, but that's what happened. My mom has been a NICU nurse for almost 17 years now, and I thought I would at least make it to 10. But within my first year of working as a nurse, I experienced lateral violence, bullying, retaliation, and severe burnout to the point where I wanted to leave my unit, but my manager was blocking my ability to switch units, so I felt trapped. I felt unsafe, I felt unsupported, and you just shouldn't trap someone in a role. Like, that doesn't make sense, and it's also not good for your mental health. 2021, I had my lowest point where I experienced SI. I needed to be placed on an antidepressant. I went back to therapy, and I was not doing well. I had become numb in my role. It was like Groundhog Day. Like, I was waking up, going to work, getting through each shift, not really remembering what happened, going to sleep, and then doing it all over again. And on my days off, I would just rot in bed. And my husband actually looked at me and he said, you know, you haven't been present, you haven't been here in X amount of years, all because of my role. At this point, I have sent a letter to my CNO and COO about how burnt out, how morally exhausted and distressed my coworkers are, how there are unsafe conditions that have yet to be addressed on my unit. I'm invited to this lunch with my CNO and my COO. Start talking about the safety issues that I try to address in my letter. They let me know that there is a plan to get central monitoring devices into this specific unit and into these patients' rooms within the next 6 months, which did happen, and that was a miracle. It was so needed, and I'm glad that change happened. I was asked, what would it take to retain nurses, but you can't talk about money? And I said, well, you're spending all of this money on travel staff while your nurses haven't had a livable wage increase in I don't know how many years. I told them flat out, you need to invest in your staff nurses. You need to invest in them. And this person looked me straight in the eye and said, well, Sarah, if we gave everyone in the hospital, not just nurses, a $1 raise, that would cost the system $2 million. Would you be happy with a $1 raise? That told me that we were not worth one more dollar to this system. I realized then that these conversations were never going to go anywhere because our priorities were not aligned, and they never would be.
No matter what they do, they feel like they have not been doing enough. Not only that, but they are mentally drained. Some of them feel like their life have been passing by. They feel like they have not been appreciated. Time, their investment, years invested in their nursing degrees to only feeling as if they want to quit now. Most of them feel as if they're not being supported with their staff members, their upleads, their manager. A lot of them feel mentally drained because they have been working very hard, not sleeping enough, not eating healthy at all. Some of them have to pick up overtime due to their lifestyle. So overall, they are feeling as if this is not it for them anymore. They feel like this is it. Let's watch this.
So tonight is my final shift as a nurse. And honestly, I don't have a backup plan. I don't know what I really want to do, and I don't know where to fully go from here. I quite honestly just feel like there's gotta be more to life than this. I've been so sick, both physically and mentally, and I just need to start taking care of myself. You know, I have a 10-month-old son at home, and I miss him, and I miss my husband. You'd think that working 3 shifts a week, whether it's day or night, would be so ideal, but really it just takes everything from you. I currently work in labor and delivery and recovery and postpartum. We do all of it, and it was like my dream job. I kind of unexpectedly landed into after I had my son. And it's been so rewarding in so many ways. I work with an amazing team of people, but at the end of the day, like, I am giving so much more to these moms. Everything I have goes to these patients, and I'll sacrifice anything for them, to the point where I come home with nothing left. I'm not eating. I'm not sleeping. I've lost like 15 pounds since starting this job. Before shifts, sometimes I feel like hopeless. I just know that I'm made for more.
I'm not a nurse, but I do understand as it relates to patients. Sometimes, you could be caring for a patient, and based on when a family member decides to come in, it could be, in between that time frame where they probably are trying to transition, or perhaps something isn't going right. And as a result of that, on the patient side, relative can look at things at a certain way, not knowing that, this nurse has been with them for the past 12 hours or 8 hours or 4 hours, So I get it. I get how things look at times, but all due respect, I have to respect all nurses. I have to give it to them, because at the end of the day, we do need nurses. You can take a look now and see that AI is taking over. Do we really want AI to take care of patients? Like, will that be effective? I don't think it will be, because at the end of the day, human beings need to take care of human beings. Why? We have love, we have compassion, we have empathy. Will a machine have empathy, love, and compassion to deal with patient? Can a machine effectively do a heart surgery? I mean, I don't know, I could be biased, but I just feel like we need our nurses, we need our doctors. So let us give nurses some grace. Let us acknowledge their work, because I know it's a lot of work. They put in a lot of work. My sister is a nurse. She's been doing her thing for over 12 to 13 years, and she's doing a phenomenal job. However, she does have challenges also on the job. I mean, she may not disclose everything, but sometimes, her back hurt or something hurt. She's not getting enough sleep, And not to mention, when you want to start your family and you're in nursing, it can definitely put a toll on your family life.
I quit another nursing job. I cannot be the only nurse who has not enjoyed being a nurse like the last year or two. Went from working in the ICU to going into home health, from one extreme to another. And I lasted in home health for about 3 months. So now I kind of don't know what I want to do. Definitely don't want to go back to bedside nursing, but I kind of have to, because all of my experience is in critical care, and I'm having a really hard hard time finding a job that is outpatient or a procedural area without having experience.
One of the craziest things that ever happened to me at work, I work for a doctor, and he's objectively the worst one in the entire city that I work in. But I was monitoring the text line that patients can text into and ask questions, and somebody called actually, and she told me that she has a problem with her medication or is giving her these certain side effects. And I knew that the doctor didn't like this patient because she came in and she always took forever during her appointments, but whatever, she was actually a really nice lady. Anyways, I went and asked the doctor the question because I didn't know if that was a normal side effect or not, which is what I was supposed to do. That was literally my job description. If I didn't know the answer, then I went and asked the doctor. So I went and asked him, and I was like, hey, this patient is having this side effect. Is that normal? And he was like, he starts freaking out, and he literally threw down his paper, and he was like, you can't answer the phone ever again. And you know what? You need to turn your phone off because I don't even want to hear anything about that patient. And you should have known that you shouldn't have answered that patient. I don't want to hear anything about that patient. And you can't ask me that question. And I was like, okay, well, I already talked to her on the phone and she's just wondering if that's normal or if that's like a bad side effect. And he was like, tell her it's normal. I don't even care. Just tell her it's normal. And also, you turn in your phone. You should not be allowed to answer the phone because I do not like that patient and I don't want you asking me about her. And so then he just yelled at me in front of everybody, the entire like clinic of MAs and all of the other people that were working. So then I went and sat back down in my little station in front of my computer, and then somebody asked me if I was okay. And so then because they asked me that, I immediately started crying, and I was like, yeah, I'm totally fine. It's whatever. It's fine. Mind you, the person that asked me if I was okay was literally his daughter. Anyways, so then the office manager texted me, and she's also his daughter, and was like, hey, what happened? Like, somebody told me you were upset. And I was like, well, this doctor just yelled at me, and it was literally just because I was doing my job. Like, I know he doesn't like this patient, but like, she still deserves care. Like, he's her primary care doctor, and she didn't know if the side effect was normal, so I had to ask him if it was normal. And I also was like, also, he literally yelled at me in front of everybody and threw something at me, and that's just super unfair. And I don't really appreciate that. Then she's like, oh, I'm sorry that happened. And that's literally all she says. Then his wife, who's also the other office manager, calls me into her office. And she says, this is like the next day. And she says, so I heard you were, worried that this doctor was upset with you yesterday, and I just want to tell you that sometimes he just likes to publicly teach. He's really good at teaching his employees, so he wasn't getting mad at you publicly. He was teaching everyone, and he was using that opportunity to teach everyone and help them all be better. So he wasn't yelling at you, and he wasn't mad at you. And I said, okay, well, you weren't there, and he was yelling at me, and also nobody else in the entire clinic does that job, so he actually was not teaching them. But okay, so then I just sat there because I have no spine, and I was like, okay, that's fine. And then this is the worst part. She says, also, I know in nursing school they like teach you that you need to stand up for your patients, even if that means going against the doctor, but we don't do that here. There's no need for that here. Whatever this doctor says is the way that we do it.
There has to be some balance somewhere. But nevertheless, our nurses are not happy anymore. Usually nursing was the thing. Everybody wanted to capitalize on nursing. Everybody wanted to be a top nurse because we was told that nurses make the most money and doctors, But again, what does it worth it going to college for such a long time, doing your residency or your internship, and then, you spend so much money to invest in your career to now not even happy working it, not even, wanting to quit. I mean, it gets a bit shaky, so I just want to say, let us respect our nurses. Let us give them some credit for what they're doing and not have to. And so I want you to look at it on both sides of the spectrum. And it's not easy to deal with patient, and as well, it's not easy to be a nurse. However, let us take off our hats to nurses and show respect to them no matter what, because in situations and circumstances, no matter what, we need our family to be taken care of. We need nurses and doctors to take care of us. So let's just acknowledge them and have respect for them. I want to hear your thoughts on this video. Let's talk about it.